Hi, my name's Karen E. Wells, and let's move on now in this holistic pain management course to look at Module 2, which is all about emotional pain and stress. I'm just going to reiterate that you should have downloaded or printed off the training manual, and in Module 1 I told you how to do that. So it's essential that you work alongside these video modules with the video modules, of course, and the training manual so that you've got a full in-depth course on this holistic pain management. So let's look at emotional pain and stress. And quite often the two are very much linked, which means that people that are suffering from emotional pain and stress can coerce the two and they can become visible within the body. Now, this module goes in depth into looking at the fact that people that may have suffered with PTSD, post-traumatic stress disorder, are more likely to suffer with emotional stress and pain. This video is about to change into some slides, so we're going to look further in at that more, and I'll see you at the end of this module. So as we move into Module 2, which is all about emotional pain and stress, there's been a lot of research into chronic pain, including the connection between pain, stress, and the emotional issues that are experienced. Research has indicated that anybody who has suffered from extreme trauma and as a result from post-traumatic stress disorder, PTSD, these individuals will be at a much greater risk of developing chronic pain. So when we talk about chronic pain, we consider it to be prolonged, lasting for much longer than it should naturally. So this type of pain may be as a direct result from an injury, from a disorder of the nerves or inflammation, but some people suffer chronic pain even though there's a distinct absence of the conditions. It can have a debilitating impact on the individual's life and certainly hinder their ability to function normally on a day-to-day basis. So those with chronic pain will often search for medication, which may only, of course, help in the short term and possibly compound the actual problem itself. So alongside chronic pain, there's often anxiety, depression, and maybe even hopelessness. So there's long been the connection between emotional stress and the physical body, but certainly headaches, irritable bowel syndrome, and fatigue are common. Emotional stress can lead towards many physical complaints, and this is something to consider when discussing pain with your clients. So when people become anxious or stressed, there's far greater tension and constriction within the muscles, which, if not alleviated, will cause the muscles to become fatigued. So around 15 to 30% of those patients who have experienced chronic pain will also have PTSD. So when a traumatic event occurs, the nervous system of the individual goes into survival mode. When it remains in such an intense survival mode, cortisol is continuously released, leading towards an increase in blood pressure and blood sugar. This can impact the health of the body's immune system, reducing its natural ability to heal. So we're looking at tension headaches. These are probably the most common type of headaches, and 80% of adults will suffer from them, women more so than men. We're looking at chest pain. This, of course, is always preferable to seek out medical help just to be sure that there's absolutely nothing serious that's occurring. We're looking at general aches and pains, stomach issues, insomnia, a poor immune system, hypertension, and stress relievers. This is all contained within Module 2 of the training manual, so make sure that you do download that and really read through it. What's going to help with holistic pain management is exercise. Endorphins are released in the brain during the exercise, and it's a natural way to reduce the stress and aid the healing process. So that brings together the end of Module 2. There's some self-assessment tasks, as always, at the end of this module, just to make sure that your learning is really up to date with the training manual and you're really getting to understand everything about this holistic pain management course. If you're happy with all of that, I'm going to see you on Module 3. Have a great day.